Welcome back to another edition of Purely Mental with Jim KAROL and Dave Wheeler. Jim, how you doing so far?
I'm doing fantastic. You know, all these doctors that I've known over the last couple of years since I'll tell you what happened. I was in Texas, all right, doing this big Wounded Warrior conference, and all these top doctors were there to try to find solutions for PTSD, what they call it PTS. They dropped the disorder. And I met this one guy down there. He had a clinic down there with SPECT scanning and stuff like that, and his name was Dr. Dewey Lee. And I'm like, wow, I go into this building. It's like an immense building, and unbelievable building. And they had like dozens and dozens of pictures, like maybe 4 foot by 3 foot, big poster size of full color images of the brain and
different parts of the brain that obviously don't normally see. So that's pretty cool.
And that really intrigued me. And then, you know, and since that time, I've gone on to meet Dr. Daniel Amen, who also does that. I mean, I don't know where the heck this world all of a sudden blew up on me here, and these guys are like rocket scientists, no pun intended. But Dewey's a really good guy, and I think we're going to get him on the phone today probably, and that would be a great guy to talk to because, you know, he deals specifically with the mind, you know, purely mental. It just fits.
So Dr. Lee, as you mentioned, Jim, he's also certified by the American Board of Anti-Aging Medicine with fellowships in functional and how do you say that?
Rejuvenating? Yeah.
Rejuvenating. Maybe he can help me with my brain, apparently, this evening. Rejuvenating medicine in stem cell medicine, which a lot of people don't know about stem cells.
Yeah.
You know, you think of things from the past, but it's millions of years ahead from 10 years ago even.
Yeah,
so
and I know he doesn't do it with the embryos. He takes your stem cell out of your body, works his magic, sticks it back in your body, and you then have the stem cells of a 12-year-old boy. I mean, that's how I understand when I was down there. This guy's amazing. Yeah, let's get him on the line. That would be a lot of fun.
Let's get him on the line and see how this voodoo magic is done.
Yeah, voodoo magic. Hey, like I said, that's what this show's about. We're in search, purely mental. I'm in search of the real thing, folks. We're not looking for no hokey pokey magic. You know, we're looking who's real out here and who isn't, and it's up to you to decide. We'll give you all these people. Mr. Dr. Dewey Lee. How are you, Dewey?
Yes, I'm okay. How are you?
This is Jim KAROL and my co-host here, David. And it's a pleasure to have you come and join us and talk a little bit because David's perplexed here. He goes, he has no clue of what regenerative is, what
no concept of it's like voodoo magic to me, as I said to Jim. He's saying you could take something and make it into a 12-year-old boy. Now that sounds like odd to me. So how does this work?
That's a great idea.
Yeah, so I figured I'd get you on and try to explain it a little better than me. I'm just a guy that memorizes things. I don't really know medicine. I have no license. So, hey, my question to you is, what I'm really interested in is this stem cell. Like, what exactly do you do with the stem cell? Like, was I right about it? You take the stem cell from the individual, work your magic, and shoot it back in? Like, you don't use the embryo stuff like they did years ago? Or?
Oh, yeah. Well, that's a huge topic. You know, I mean, stem cells. I mean, let's go back to the era of W.
Okay.
President Bush the second, and the whole thing we went through for almost 5-6 years about embryonic stem cells and controversy, and so it was pretty much decided that I don't think that really made it officially illegal, but certainly was almost illegal to do embryonic stem cells, and because of the controversy of farming stem cells, basically. They didn't want people to farm babies or farm embryos to get stem cells, because nobody was going to do that. But so it's basically illegal. I think that there's some academic centers that still do embryonic stem cell research. But what's interesting is that since then, all the research has shown that the adult stem cells that we get from our own bodies are just as effective, if not better, than the embryonic fetal stem cells. Isn't that amazing? And then the huge depository of stem cells in your body, guess where it is? It's all, of course, in the bone marrow, which everybody knows, but what's amazing is that your fat cells have 10 times more stem cells per volume of tissue than bone marrow. So all the stuff that we do when we do, I'm a cosmetic surgeon. I'm also trained in stem cells as well, so I do a lot of different things. So when I do liposuction, I'm actually throwing away all these people's stem cells.
That's interesting. Dewey, here's my question. Like David here, say he has a bad shoulder, a really bad shoulder. I mean, you mean you could take stem cells? I mean, stem cells could be removed from his shoulder, and they could be replaced, and he could be cured?
No, it doesn't work like that.
Okay.
Now, stem cells are okay. So let me just kind of tell you a little bit about what the stem cells are. So stem cells are, it's a regenerative cell that regenerates tissue and everything in your body. From the time you're born until you die, there are stem cells that are floating around, running around, making repairs. And when you're young, as a baby, in the first 10 years of life, you have so much stem cells. So if you ever get cut or injured or whatever, you heal almost instantaneously. Right?
Yeah.
And when you're a little baby, if you get a cut even in your face, you really don't have a scar because your body just completely restores that. And that's how effective stem cells are. And what's interesting is that as you get older, the stem cells, the production and their effectiveness go down very, very quickly. So if you're in your 50s, you're probably down to maybe 30% of what you had as a kid. And when you're in your 60s and 70s, you're down to 15 to 10%, even lower than what you have. So even though you do have some stem cells that affect your, repair, it's much, much lower. And what stem cells you have don't work as well. So that's why when you get older, it just takes such a long time for anything to heal. If you get cut, it takes a long time to heal. If you injure your body and pull a muscle or tendon, you get the aches and pains that last forever. And it's all because the stem cells are just not as effective, and you just don't have enough, number one, and they're just not as robust. So they're just not there, and that's a problem as you get older, and that's part of the aging process. But even when you harvest stem cells and put it back in, they just, you're putting in, you're concentrating it, which is nice, so you get some increased dose, but, you're still putting in ineffective stem cells. And it's not a panacea for everything. If you actually have, let's say, a big rotator cuff tear, putting in stem cells is not going to necessarily regenerate your whole cuff. Some things have to be done by surgery. But if you have a small tear or maybe a partial tear, depending on what it is, injecting stem cells would probably do a very good job in, regenerating or, healing that injury. So you have to really look at the situation and kind of look at it in terms of, okay, what do you actually have and what can these things do? And not look at stem cells as like this magic pill that can fix everything, because they're not.
How about sports? Like, how about an athlete? Could you make an athlete into a super athlete with stem cells?
Well, I don't think so, because those super athletes come from, number one, you have to have the genetics to kind of enhance your ability. And from there, you got to put a ton of work in.
Well, no,
right?
I know that. But like, say I'm an athlete, I'm worn down.
But, stem cells by themselves are not going to make somebody into a superhuman, because that's not what it's for. It's not going to give you any more strength than what you naturally can have, right? Just because you put stem cells into your muscle, that doesn't mean you're going to, let's say you're a weightlifter, okay? You get stem cells and you do stem cell treatment, and you're not going to wake up next day or a week later and be able to lift 3 times more without doing any extra work.
Okay,
but
good.
Stem cells can help your muscle, maybe recover faster from injury, maybe regenerate a little faster. But you're not going to grow any extra set of muscles and become 3 times stronger or whatever from stem cells. That's not what they are. It just helps you heal and recuperate and kind of regenerate damaged tissue. But it's not going to, let's say, I know you're involved in the brain stuff, Jim, because of your memory expertise and all those kind of things. So putting in stem cells into somebody's brain or into the blood vessels, let's say, it's not going to create all of a sudden this horrendous, brain power of memory and whatever.
That was my next question.
Yeah.
Like, how about a wounded? How about like somebody that has an injured brain? Somebody like
yeah. Well, those kind of injuries can help heal, with the stem cells. Oh. And I was going to get into things like, multiple sclerosis and, degenerative disease like Parkinson's, and just tons of research going on in those areas. And depending on how you actually, harvest the cells and deploy them around the brain and, all those kind of things, some people have gotten amazing results in terms of how people actually recover from things like Parkinson's disease and multiple sclerosis. But they're all, every person has to be evaluated individually to find out, what the status of their disease is and what type of disease they have, even a subset of something like Parkinson's disease, and to see if stem cells can even actually, be helpful for them. They're expensive. This is a bit traumatic in terms of the harvesting procedure. It's not a major surgery, but, you have to go through a little bit of a minor surgical procedure to get the stem cells out. But still the cost is there to put all these things together. So it's not a trivial thing. And the evaluation you have to go through and really kind of finding out what type of problem you have is really critical. And then there's the restriction of what you can do. I mean, right now in the United States, FDA is clamping down more and more and trying to restrict doctors from, doing this kind of treatments. And, in some ways I can understand it. There are a lot of little charlatan clinics that are out there touting stem cells, and when they're not even stem cells. You know what I mean?
Yeah.
So the consumer really has to be quite aware of possible scams and just spending money on something that's not going to work. So
David has a question. David, go ahead.
Go ahead. Yeah, go ahead.
So here's a good question, because I obviously don't know much about this. So once you get the stem cells out, how does the person get it back in? Are you taking like a vitamin with it like made in? I mean, I'm probably asking a stupid question to you, I would imagine, but is it shot or?
None of these questions are stupid. I mean, if you're asking about it, then somebody else is thinking the same thing. So don't think that way. No. So anyway, there are two ways. Let's talk about two categories of stem cells. One is what's called autologous. Auto means self, so that comes from your own body, okay? And then the other main type is called allograft cells or allogenic cells, and these are coming from other cells that are outside of you. So that category would go into things like, umbilical cord, amniotic fluid, umbilical tissue, sometimes placental tissue. So you can actually get stem cells from those tissues from, newborn babies. Of course, they get tested and, cleaned and all that. So when the baby, when the mother goes through the delivery process, some mothers will actually bank the umbilical cord of their baby, sometimes the placenta, or sometimes they'll actually donate to these different companies or whatever, amniotic fluid or cord blood, and some cord tissue for research and producing, allograft stem cells. So that's another source, okay? And then most people are still doing what's called autologous, which means you're getting the stem cells from your own body. Of course, that's your own body, it's your own cell. There's no worry about contamination or reaction to the cells, and all these things that we talk about as a possible precaution, it's just not there. That's probably the safest way. And so the two main sources that we're using now is from the fat. So, for me, if somebody comes into my clinic, I would do a little mini liposuction, on your tummy, and take out maybe 100 grams of fat or maybe more. Or you can actually do bone marrow aspiration and, just take out about 60 cc's of bone marrow. And they have different companies make different kits that, process this and isolates the stem cells for you. And then that's the rub, in a sense that there's no real uniformity in, what companies do what with the cells. So some companies will produce a lot of cells and some companies won't. And there's no way to really know, So that's the ongoing debate, I guess, if you want to call it that, in terms of how consistent these stem cell products are and how consistently, you're getting the stem cells from somebody. And even where you harvest and what part of the body you harvest matters too.
Like David knows, I worked in a damn steel mill. I have no formal education. And people like Dewey Lee, Dr. Dewey, you are my friends. How is this even possible? How do I all of a sudden surround myself with people like you? And I worked at a steel mill.
You're a very special person. That's why.
Oh, this is so awesome. I mean, this is what I do, David. Every day, the normal person, I call doctors like Dewey Lee, Jim. I call all my doctor friends, and they educate me more, and then I quickly study what they're into. But stem cell, I looked into that, and I'm like, that's it. I'm not doing this. That was just too complicated for me. So
it's actually not that. It's just basically some simple biology and just understanding some basic biological transfers.
Just simple biology.
So one thing that I do, that is kind of a little different maybe is that I add something called exosomes with my stem cell treatment patients. And the reason I do that is because, as I said earlier, when you get older, the stem cells get a little weaker and you don't have as much, right? So even if you collect them and concentrate and inject it back in, those stem cells are kind of old. So the transfer of information from the stem cells to the cells that are already there are not as strong. So the what's called mRNA, which is the translation process by which the cells start replicating and developing and doing the healing part, that just don't work as well. So what's interesting is I have some people who are developing what's called exosomes, and these exosomes actually take this information from the stem cells into your regular cells and help translate the information. And that translation process becomes very, very efficient because of these exosomes. And the conversion process, if you will, almost looks like when you're much, much younger. Does it make sense?
No,
it's a little like you're kind of turning back the time a little bit. Yeah. So when you're older, these things don't work as well. But when you're younger, they used to work very, very well, and very, obviously because you heal better. So these exosomes help kind of change the efficacy of the stem cells. Even though you have older stem cells, they behave as if they're much younger.
Now, okay, I'm an old guy. All right, I'm 64. Now, is it possible to slow down the aging process of your cells?
Yeah.
Am I doing something? What am I doing, Dewey?
As we talk, I'm in Tucson, Arizona.
Yeah. Oh.
Right now, I'm at a conference called Age Management Medicine Group. It's an AAMG, and it's one of the major groups. And I did a lot of work with A4M, which is another company. But this is all about anti-aging, quote unquote, or how do you manage aging and how to slow it down, how to defer it as long as possible. So we're talking about stem cell. We're looking at something called, telomeres and platelets, platelet-rich plasma, and hormone therapy, and how to reduce inflammation in your body. What about growth hormones? And all these kind of things. And in fact, I'm sitting in a lecture. In fact, I need to go back to it in a few minutes on traumatic brain injury. I'm working with a very famous doctor, Dr. Mark Gordon.
I know Mark Gordon. Oh, my God.
You know Mark Gordon.
Yes,
yeah, he's the one. He's been lecturing all day. I mean, he's amazing. Absolutely amazing.
He is amazing.
So I'm learning all this stuff that he does with his work with hormones and how to treat traumatic brain injury from all the veterans.
And he's helped Andrew Marr, one of the veterans.
Oh, yeah, he's actually sitting in the back.
Yeah.
So I'm learning all the stuff he's doing. So I'm going to be part of his team to start working on all these traumatic brain injury patients with hormones and his protocol. And, I do the SPECT imaging, and then I also do stem cells. And I don't think Mark does that, but it's okay. I mean, we'll bring in different things that we do. And I know stem cells are going to have a tremendous impact on, healing the brain from a lot of different angles.
Exactly what
hormones
it's all
are great.
About. Yep.
Rebalancing and reducing the inflammation is great, obviously, but I think the stem cells will have their own role to play.
Yep, and we're getting a nice group of people together, like Dr.
Oh,
like yourself. Oh, man, this is fantastic. What's your best website to look at if you had a website you want people to look at?
My website is called advsurgicalarts.com.
Okay.
And then my brain website is called Mind for Life.
Mind for Life. Okay.
Mind like mind, brain, Mind for Life.
And we'll link all of these to JimKarol.com. Dewey, man, you're awesome, buddy, as always. You have fun down there in Tucson. Is it hot down there? What is it, like 120 or what?
Oh, it's beautiful. No, it's like 80-something, like 84. It's dry, and it's just gorgeous.
Oh, I don't
have my allergies.
I got to come down there sometime. That's one town I've never been in. Dr.
Really?
Dewey Lee, you are awesome. It's a pleasure.
Hmm?
What do you think, David?
Amazing. I appreciate your time. I just actually have one more quick question if you have time.
Yeah, sure, of course.
Where do you see the future? Where do you see the future of stem cells? Like in the next 5 to 10 years, what's the goal of stem cells in your research?
I think in the next 5 to 10 years, it's going to be the mainstay of treatments for illnesses around the world. And I think right now we do all these complicated things to harvest stem cells and process it and all this kind of stuff. I think it's going to almost become off the shelf. We're going to find ways to use stem cells from, different, the allograft cells, the cells that are from younger people, umbilical tissue, let's say, just for the lack of variety. Things like that. Even though they're not from your body, these cells have very, very low reactivity, immunological reactivity to your body. So it's fairly safe to use, and we have ways to remove that marker. So I think eventually it's going to become pretty commonplace to go and pretty much, quote unquote, buy stem cells off the shelf for different purposes. That's what I think. I think surgery is going to become, obviously it's necessary. Sometimes you just have to fix things physically. But, depending on the severity of injury, I think surgery is going to become less and less. I think we're going to start really fixing things from even, muscles and tendons and joints more and more with stem cells. And I think things like, joint replacement is going to pretty much go away. You can regenerate cartilage. We're doing that already. And all those kind of things we see as being really complicated is going to become much more easily done with stem cell treatment. And that's kind of what I see in the next 5 to 10 years.
That's fantastic, Dewey. And you're in with the right bunch down there, the Wounded Warriors, man. They need this more than anybody.
Oh, I know.
And you tell Andrew Marr that Jim Karol said hi, and I want to get his butt on this podcast. All right. Have a good one, Dewey. Thank you so much.
Well, thank you for having me on. I appreciate it, and it was fun.
All right, bud.
Thanks a lot. Have a good one, okay?
Thank you. Take care. Bye.
I'm amazed. Yeah. You keep bringing all these smart people on, and it's just like you're learning so much instantly, and it's...
Well, this is the whole idea, Dave, to surround... I'm surrounding myself right now, I swear to God, with the most brilliant minds on the planet. I mean, where do you see some of the people I know, like from MIT, from Harvard? It's amazing what happened all of a sudden. So that's what Purely Mental's about. Purely Mental, the real deal. And at the same time, you have the mental, like we talked about, the jackass guys and the crazy football players and the linebacker. What are they thinking of? And like, what are you thinking of right before you shoot that 3-pointer for the winning? Yeah. And this is what the thing's about. We want to study the brain, and the best way to do it is to surround myself with the most brilliant people in the world, because I, by no means, I'm not brilliant. All right, I'm just a guy that got lucky and learned how to memorize a few things on my exercise bike, and wow, it's amazing what it turned into. What a ride, no pun intended.
Yeah, right. And even just what Dr. Lee was talking about with stem cells. I mean, no one knows what's going on. Like he said, I still thought it was babies. I don't know much about it, so I'm thinking, why are we doing this? And then he's talking about it's literally from yourself.
Yeah.
It's any part of your body. They get it right from the bones. They get it from the muscles. It's amazing that we have stem cells. I didn't even think that. I thought you don't have them.
So, and when he sent me all this paraphernalia to look at to try to do, I looked at it, I'm like, no way. Yeah, I'll stick with the bones and the brain and the circulatory system and the skeletal, the muscular system. I'm not studying stem cells. That was just so complicated. But hey, it's better to have these guys around me. That's what this whole thing's about. The more we get the word out, the more we're going to gravitate to these people. You should see the doctors. I mean, like the conference he's at right now, the conference that I'm going to next week. I mean, it's just before you know it, you have the most brilliant minds around you. And it's really cool being a former steel worker. I mean, I'm hanging out with these guys. It's like, wow, it's crazy. And that's what this is about.
And that's the nice thing, too. It is about it. So you're going to learn everything from the mentalist side of it, but you're going to learn about the brain. Like we just learned that, down the line, if you have knee trouble when you're older, in 10, 15 years, you might not have to have surgery. You could just get the stem cells worked on and boom, you might not have that knee problem anymore. So,
and that's what this show is about. And that's what it's going to be about. When people go to the website, I won't be able to answer or solve your problems, but my network, somebody within my grasp will be able to help you. That's what this is about, to get everybody to have the answers on this site, JimKarol.com. Anything you wanted to know about the brain, anything you want to know about your body, about sports, you just go to that site and we will have the answer for you. And if we don't, pop us a question and we'll go look for the answer.
We'll search it out. Yeah. And again, you can get the podcast anytime online at JimKarol.com. Follow Jim on Facebook, Twitter. Keep us in the loop. And again, the podcast always, JimKarol.com.